Hi, I'm Christian Müller. I'm a professor of cardiology at Basel University Hospital, and it was my pleasure and honor to present on behalf of the GALACTIC investigators the primary results of the GALACTIC randomized controlled trial here at the ESC meeting in Paris. So GALACTIC was the largest investigator-initiated randomized controlled trial performed in acute heart failure until now. And it was unique in the sense that it tested a strategy, not a single drug. A strategy of comprehensive, early, intensive and sustained vasodilation in the treatment of patients presenting with acute heart failure to the emergency department. The GALACTIC study randomized 788 patients to either usual care or a strategy that used intensive vasodilation in addition to all our therapies that we use in acute heart failure, mainly loop diuretic therapy. So the background, of course, is that although patients have quite good symptomatic improvement in response to loop diuretic therapy, mortality and morbidity have remained unacceptably high for patients with acute heart failure. About 40 to 50% of patients treated for acute heart failure will be dead or in hospital again for acute heart failure within 6 months. So, and therefore, based on very promising data in patients with severe pulmonary edema with high dose intravenous nitrates, our concept tried to see whether in the broad acute heart failure population also we could improve outcome with early intensive vasodilation, using drugs in a formation that was optimized to the use both in the emergency department and then on the general ward, including in the first phase sublingual and transdermal nitrates accompanied by hydralazine or with its complementary hemodynamic effect and to prevent nitrate intolerance. So the second phase included very rapid up-titration of ACE inhibitors, so that ultimately at discharge our aim was to have patients with lower filling pressures and higher doses of the life-saving therapies. The primary endpoint of the GALACTIC study was the composite of all-cause mortality or acute heart failure rehospitalization throughout 180 days. The primary endpoint occurred in 27.8% of patients in the usual care group and in 30.6% of patients in the intervention group. So the Kaplan-Meier curves were more or less superimposable. Therefore, unfortunately, the intervention did not statistically significantly improve patient outcomes in patients with acute heart failure.